You're still watching iBrand Daybreak, and now it's time we talk about health. Uterine fibroid has been identified as one of the most prevailing health challenges among African women. There have been different studies on the prevalence and prevention of fibroid among women in general, and even among celibate women. We have Dr. Abiola Akani in the studio, a medical and herbal practitioner, to educate us on types, causes, and symptoms of uterine fibroid. Good morning, doctor, and thank you for being on the show once more.
Good morning.
All right.
Good morning, everyone. Yeah.
Please kindly educate us more on uterine fibroid.
Uterine fibroid is what we call, is another name they call is Myoma. And Myoma, yeah. That is a growth and non-cancerous, but some cases some people believe it's cancerous growth, but it's non-cancerous growth that is commonly in female in the womb, and it has sizes and it has locations. This growth started growing on the daily basis on certain reaction to certain things in the body, and changes the menstrual flow is one of the key things when it comes to childbearing age of women. That's one of the health challenges that they experience when it comes to this growth of myoma and the fibroid, that it leads to other health issues or complications when it comes to childbearing. And sometimes, most cases, 60% is symptomatic, that there's no symptoms, no feeling at all, but some comes with heavy bleeding or spotting, and kind of resulting to anemia. That is a short of blood, and sometimes painful sexual intercourse, or low abdominal pain, or menstrual pain, or sometimes affecting ovulation stuff. But the causes of fibroid myoma medically is is unknown, but it was traced to excess secretion of what we call hormonal profile imbalance, that's as a result of excess estrogen hormones in female. And the hormones are the supplements or the contents that regulate when it comes to female reproductive disorders or female activeness in female. When we are talking about estrogen hormones, we are talking about prolactin, follicle stimulating hormone, and luteinizing hormone. But when these hormones are not at the adequate level is supposed to be, there will be changes of these hormonal changes in the body. From then, when there is an accumulation of estrogen hormone, the accumulation now find anywhere to be accumulated. It can be anywhere. That means that's when it comes to sizes and location of fibroid. And we have different types of fibroid, meaning the fibroid we have submucous, we have subserous, we have intramural. There's outside the womb is the subserous, that is outside the womb, it's not inside the womb. Okay. The one inside the womb is submucous, and the one in between the wall of the womb is intramural, meaning that they have different symptoms and different effects on childbearing age women that's trying to conceive, or sometimes leading to what we call miscarriage or heavy flow or spotting.
Okay. I mean, you've said a whole lot. I'm trying to, simplify. I want to simplify this for, our viewers out there. You said earlier that some fibroids are non-cancerous and some are. So, can you give us examples of those that are cancerous so that we know what we're dealing with?
Most fibroid is not cancerous. Okay. But in the case whereby the fibroid is not well managed, or the patient itself has a cancerous growth in the body, and anything will cause anything. The word cancer is any excess growth of anything. If my hand is now getting bigger, though, be abnormal, it becomes the hand is cancerous. If the kidneys become, that means any excess growth of any organ in the body can query to be cancerous. That means if the multiple fibroid has started now growing, multiple fibroid, and it was not controlled, and the accumulation of hormones are there, and the fibroid is just multiplying. Before you know it, if the man has not get to menopausal stage, meaning that the cancerous the growth can probably have a cancerous there, from there developing and unable to control, even after the surgery, can have a kind of effects or spread over the body system.
Even for the asymptomatic ones, the ones where there are no signs, no spots in.
Yes, because most cases, I was saying about the types of fibroid, meaning that most cases the submucous that causes heavy flow because it's inside the womb.
Okay.
It's within the womb, meaning that anytime a woman is experiencing his menstrual flow, as the flow is flowing, the irritation of that growth in the womb, that inflammation causes that woman to be, the body find it as if it's a foreign system in the body, and you see that inside is like maybe a child, the body is trying to push it out from there, allowing the woman to lose more blood.
Oh,
At the end of the day, every cycle, every month, it's possible a woman losing 2% of blood every month. In the next 2-3 years, what do you expect? It becomes that woman will be anemic, and it can lead to terminal case if not well managed or well controlled.
So what are some of the causes of uterine fibroid?
The causes of uterine fibroid is, I've already said, is excess secretion of estrogen hormones in women, and use of family pills or contraceptive pills, because some ladies are, and another thing is that early puberty age, like a lady that has sexual activeness at early age, or the menstrual flow started at early age of maybe age 9, age 10, age 11, it's possible for that years of hormonal secretion, and the lady is not probably settled down or conceive at the right time. The hormones will be accumulated from there. The space there, it's possible the fibroid develop, because almost 60 to 70% of female of childbearing age has tendency to have fibroid, to develop fibroid.
Okay, one of situations where, so got some persons to say if you have fibroid, then you should look for a way to give birth at some point, then probably it would reduce, or it would, I don't know how to put it, melt or something. How true are those claims? Very true.
Okay. That the key factor is that with the experience is that it's expected a female to have a childbirth at early stage. It helps, it's like an exercise, like an exercise and a kind of dictator of the womb. The womb has excess blood flow during 9 months pregnancy, and the hormone involved in this new 9-month pregnancy. After the labor, the delivery, the breastfeeding is also hormonal changes. During the process of breastfeeding of that baby for another 9 months or 1 year, it allows the womb to lubricate with certain hormones and allow the hormones to be regulated with the process of those activities. But when a lady is not doing those activities and just engage in sexual intercourse for years, meaning that it's like you have 5 objects and you are making use of 1 object, meaning that those remaining 4 objects there will be dormant and there will be problem to them. Meaning that is why the process of sexual intercourse is the aim to get to conceive a baby, and that conceive is like a course, a program of maybe like, let's say 9-month program or 2 years program, meaning that there's pregnancy for 9 months, there's breastfeeding for 9 months. You are talking about 2 years course, meaning that when that course is involved, the whole system is what involved. That's why active, meaning that's why a pregnant woman, you see them adding weight, the breast is getting bigger, the hormones is, you see them adding weight during 9 months. During the breastfeeding, those hormones accumulated during 9 months have to be coming out to form breast milk for the baby. Or the process whereby those hormones are not working or are not active, you are not making use of them. And with my experience, I always, some women will always say they will cast fibroid, that maybe spiritual is an attack. But with my experience, it's an endowment, it's a gift from God. That's why any woman that have tendency to develop fibroid, meaning that woman has a tendency to have as many as numbers of children.
But then can't fibroid probably alter your chances of getting pregnant, or probably while you're pregnant, it's probably jeopardizes the chance of the child surviving in the womb? Yes,
it's affects, because when there is a multiple fibroid, there's what we call seedling fibroid.
Okay.
That when you have a seedling fibroid, it's just like a fibroid, like a pimples, like a drop. That means with that, if it's detected early, the lady will be advised to conceive at that period, because what she's eating, maybe diet or lifestyle, that the seeding fibroid will not get bigger. But by the time the seeding fibroid getting bigger or multiplying, having different maybe intramural, submucous, subserous, that means the pressure is now on the womb, meaning that it will alter the woman to conceive easily, it will alter the woman to have miscarriage, it will alter the woman to have some congenital abnormality in that baby, even if at the end of the day the woman have the baby and carry the baby to term. And when the baby can have a congenital effect as a result of the load of the fibroid. That's why it's advisable to every matured lady, like 20, should do their ultrasound scan at least annually to check, am I having accumulation of these hormones? Am I having fibroid? If it's early detected, there are managements, there are ways you can probably manage it and get out of it at early stage. Not that you now get multiple, that no solution than to do the surgery.
That's pap smear.
Yeah, that pap smear is related to when I'm talking, I want to trace this cervical cancer.
Yes.
Yes, but those is I like that. That's cervical cancer too. You know, we are talking about 2 years course when it comes to pregnancy. When the woman can probably do a childbearing, it helps the cervix to lubricate.
So there may be no need for the pap smear anymore.
No need for the pap smear anymore.
Okay.
But by the time the woman says no childbearing, there's fibroid, there may be tendency a cancerous can take place, because the place is like a room you locked for years. No, because there will be cobwebs everywhere, will be dirty. That's the causes of fibroid.
Okay. You said earlier that aside the use of contraceptives, use of contraceptives as well as hormonal imbalance can cause fibroids. What are the other causes we're looking at?
Lifestyle, drugs, multiple abortions.
When you say drugs, you mean hard drugs or normal medications people use?
Some drugs are steroid drugs that some ladies take, maybe like there's some steroid drugs probably to enlarge your bulbs. You know what the ladies are doing now, enlarge your bulbs or your hips. You know, those they are steroid drugs that it will alter the hormones in the body, and by the time the hormones is altered, there will be another signal to the body system to have some effects on it. That is one. And lifestyle, people that take excess alcohol, people that take oily or sugary things, it increases these hormones. It's only when you use these hormones that you are free. But when you take sugary things, oily things, excess alcohol, smokers, you understand, it's altered these hormones. Immediately the hormones is altered, there will be problem. And when it comes to childbearing age, and when you have sexual activeness, you know, when you have a sexual urge, the libido is increased, meaning that as you are having sexual urge, you are expected to make use of your system, and the hormones are there to perform their activities. By the time you are having sexual intercourse on basis of time, and the hormones are not make use of, there will be another signal to the body. Our body is just like a car or like a phone, that any what you program on it, that's what it adapts to. So that meaning that when you adapt to a lifestyle that you just have to have sex, and at the end of the day after sex you just have to go and take some pills. Some will tell you they will take certain this, some will take Ampiclox after sex, some will take so many things. Female engage in different aspects of things when after sex. Those things control the hormones or changes the hormones, from there giving another feedback to the system. Those are things that engage to develop fibroid.
Quickly, as we just wrap up the segment, are there specific signs for early detection, or rather symptoms or signs, let me use the word signs, for early detections, so you can be detected early and probably handled before it gets out of hand?
Yes, that's a good question. Is that there are early signs in different females, is that, you know, if a young lady will tell you his menstrual flow has been 28-day cycles, like the 28-day cycle is constant. By the time the 28-day cycle is not changing to maybe irregular menstrual flow, that's one sign. That means maybe the date has changing. And if the flow lasted for 3 days or 4 days, that is normal days. And now the flow is not lasting for more than 1 week, 10 days, or spotting after menstrual flow. That's true.
But sorry to add, some persons have these things naturally without, some persons have irregular menstruation and probably 3 or 4 days rather than 4 days or 3 days naturally. And would you say some persons who have this, this could be some signs of uterine fibroid?
Yes, there are some signs. Some signs of this. No, it may be not related to fibroid.
Okay.
But related to other female health issues, maybe like infections, maybe like sperm leakage, like what we discussed. It's just some people have menstrual cramps, like 2-3 days before their menstrual flow, meaning that the body is forcing itself to spot. And some will have pain throughout that menstrual flow, and some will have pain that they will not unable to even move out of the house. They know that anytime they want to see their menses, they have to be indoor for that period of time. That's a signal enough to know, well, why am I having pains when I'm menstruating? Why am my flow is longer, and why my flow are thicker? You see clotted, some people will be having clotted clots, that every clot that they have to change part like 5 times in a day, or some 10 times in a day. that is abnormal. That means those are signs. And some were having this lower abdominal pain. And some, when it comes to multiple fibroid, or the fibroid is not getting big, you start having big tummy. The tummy is coming out. Even continuing tummy, that even lying down is accessible. That when she touched her tummy, you feel pregnant. Thank you. You feel pregnant, like 2 months, 3 months, or sometimes walking, they feel a kind of movement in that tummy. Inside, I'm feeling something is moving in my womb. That's why you're now asked to do some medical investigation, to do and do some ultrasound to be sure, is it pregnancy, is it growth, is it fibroid. There are different signs, and some will be urinating. You know, early pregnancy tends the woman to urinate frequently. That means they will not be urinating because the weight of the fibroid resting on the bladder. That means the bladder will not have that tolerance to withhold the urine. You see them urinating frequently. There are so many signs, and some will anemic that day-to-day flow, you see that they are looking pale, maybe because of short of blood, or after flow, they'll be feeling dizziness or fainting, attack, all those things. So many things
let's talk about solutions, because we've spoken extensively about the causes, the symptoms, and the various types. Now, what are the solutions, treatments now, to some of these fibroids? Let's take them one by one. You talked about the ones inside the womb, outside the womb. So what are the solutions? Is there a solution for everything, or different types of fibroids have their own types of treatment?
Fibroid has solutions, and it has the same solution, because the causes of the fibroid is the same hormones. I was saying that the excess accumulation is to work on the hormones and regulate. By the time the hormones is regulated, that's one. And one of the solution that we try to educate our female is early conception is the key. Immediately you have early conception, you know that pregnancy will take at least a course of 2 years, meaning that the pregnancy, the breastfeeding, they're doing the same course, meaning that the hormones are active and active, you are making use of your system. That is 2. 3 is that your lifestyles, obesity, like adding weight, lack of exercise, those gaining weight, or those things accumulate certain fats or hormones in you, and it can deposited in any part of the body. That is, and people that take excess alcohol, they have to reduce the alcohol and lifestyle. And when we talk of medical solution to multiple fibroid or fibroid is surgery. That is, myomectomy is to remove the fibroid, and is advisable. Some will tell you, because they've not conceived, for a young lady, is it expected to do a surgery? But sometimes for you to conceive early, you have to do that procedure. But when I'm talking about herbal experience, is that the herbal solutions, that when the fibroid is still seeding fibroid, they're still in small seed, it's better you use those herbal supplements to help you to shrink them and to reduce the excess secretion of that hormones. The herbal is going to regulate the hormones in your body and reduce the excess secretion. That's what the effect of herbals on that. But by the time the fibroid has been multiple and their marks big, and size, herbal cannot have effect on that anymore. Just to place that patient on surgery.
Quickly, as a wrap up, just tell us how we can get to you, for listeners who would want to probably have these issues or want to come for a routine check, how we can reach you.
Our office is at 39 Adepeju Street, Mango Express bus stop at Onipetes Ikeja, after along Ikeja, and email abiolas28@gmail.com. Telephone number is 080-3360-2308. On Facebook too, Double Doctor Herbal, Instagram Double Doctor _23. You can get to us. You can any questions, any treatment or analysis or more about herbal practice and the medical practice. We are there for you to educate, to have experience together. Yes, and treatment. And yes, we treat and we manage as well.
Thank you so much, Dr. Abiola Kani, for that. And that was the health segment with Dr. Abiola Kani. Please do well to reach him for more questions, solutions, and also treatment. He has what it takes to make that happen. We'll take a short break now. The next segment is something you would love as we wrap up the show this morning. Stay with us.